The other thing, if we wanted to finish this, we put up here. Put the,
Oh, cool.
okay.
That's the ethmoid.
That ethmoid, yeah.
Perpendicular plate? Oh, Christogalli.
Herbiform plate, whatever. Is that right?
I think it's just one L, one I. Okay, yeah. And what are the holes called?
Pilates.
Olfactory.
Foramen.
Okay.
Foramina.
All right.
Because it's
See,
smaller.
and there we go. So now we have 2, 3, 4. And then
Send me that video.
all right, so we got it all. So starting up here, this would be the,
Ethmoid.
Ethmoid bone.
okay, which is what region on the inside we have the three-
Frontal.
Front.
Yeah, oh, yeah, between, it's actually ethmoid.
Oh, anterior.
on either side, but the anterior cranial
Yeah,
fossa.
okay.
Okay, so the olfactory bulbs will sit on here and the nerves will project down through the olfactory foramen.
Yeah.
Then we come over to the edge and here is the lesser wing of the sphenoid, which is going to divine these two arches, one on either side.
Superior
Here are
orbital.
our optic canals, and that's the little ridge in the front. This is whole things, the celotracheca and the sphenoid bone. Okay, so these optic foramina go into
Optic canal.
the optic canal goes into the orbital, to the
Oh, okay.
orbital fossa.
Okay, yeah.
Okay, so that's going to take cranial nerve 2, and then just slightly inferolateral to it is this arch structure, which is part of the sphenoid bone. All this stuff in black is sphenoid bone.
Yeah.
So this is called the superior orbital fissure, and it's going to be the next cranial nerve, which is 3, 4, part of 5, and 6. So oculomotor, trochlear, ophthalmic, which is the ophthalmic branch of the trigeminal nerve, and abducens. So they all go in and they have to do with eye movement structures. Okay? Then we drop down just to the point, we see foramen rotundum, which is going forward, and it's going to bring out cranial nerve sub 2, which is the maxillary branch, to do the area between the orbit and the mandible. Okay? And then these are all sensory. 5 is sensory, these are motor. And then 2 and 1 are special senses. 3 goes straight down, that's foramen ovale, that takes the mandibular branch down in the mandible. And then just lateral, following this archway, is foramen spinosum, which receives a blood vessel that runs inside the dura mater called the medial meningeal dura, or artery. It's a branch off the maxillary artery. And then at the junction between the sphenoid, the occipital bone, and the temporal bone is this jagged-looking hole called the foramen lacerum. And it's the output of this dotted green line, which is the carotid canal. We can't see it because it comes up from the bottom and runs anteromedially into the side, and the carotid pops out of it. Okay? And then over the ridge on the back side, we'll find in the temporal bone the internal acoustic meatus. So this is the middle cranial fossa, anterior, and now we're getting down into the posterior cranial fossa. So there's a hole there that takes 2 cranial nerves, 7 and 8, which is the facial and the glossopharyngeal. The facial is going to come out and do all the muscles of facial expression. It also does some parasympathetic structure, does the taste buds of the anterior tongue and the salivary glands, plus the lacrimal. It'll make you cry.
Oh, yeah.
Okay. And then 8 is vestibulocochlear, so that's hearing and balance and special sense. So that just stays entirely inside the Petrus region here. And then we drop down at the junction between the temporal and the occipital bone. We have the jugular foramen, which I didn't label, but that's
Is this the one? Jaguar?
Yeah, the big one there. And you'll see coming into it from the side is this big groove, which is the sigmoid sinus, which is the drain for, so that's going to come right into the side of it.
Which one is that?
That's this big, thick, steep, see that?
Oh,
That
okay.
nice, it leads you right to it. And then what goes through here is the internal jugular vein.
Vein, okay.
That's formed by the sigmoid sinus as it passes through. But we also get 3 cranial nerves. So 9, 10, 11, glossopharyngeal, which is the posterior taste buds, tongue, and posterior salivary gland, specifically the parotid gland. 10, the vagus nerve, which is everything down here. Also a bunch of throat and talking and everything else. And 11 is the accessory nerve. The I don't know nerve. Does the sternocleidomastoid and trapezius muscle. Okay. And then we drop down into the big one, and on either side of this, going right underneath the occipital condyles, is the hypoglossal canal. So that one is easy to spot
Yeah.
because
Yes, right there.
you see it in there, but from the bottom, see these? You can run something right through, directly underneath there. Do you have, anybody have
Yeah.
a probe? Yeah. So this is really easy to do. You just go, boom, it goes right underneath. And see how it passes right underneath the canal there. So that's the last place you can come off the brainstem before you become spinal cord. Okay, so that's right there.
What
and
is
right here.
innervated by hypoglossal
What does hypoglossal sound like? Under tongue. It's all the tongue muscles. That's how you move your tongue around. Okay. So hypoglossal nerve, cranial nerve 12, last one before you become spinal cord. Then they're no longer cranial nerves.
So glossal means
Tongue.
tongue.
Lingual means
Hypo is
part of
under.
the tongue. Glossal
Hypo
means
under.
tongue. Hypo means under tongue. Yeah, so they're all the tongue muscles. They're under here. You stick your tongue up, pull it back. And
Little ears in?
okay.
But the
Did we miss
taste
anything?
and the taste and everything is going to be by this nerve.
No, okay, taste, so special senses would be, okay, smell is what? Cranial nerve what?
Sinuses.
Sinus.
But it comes from the
Olfactory.
Oh.
Okay. So the next thing we have is sight.
Right.
it's orbital.
2.
Or it's just the optic nerve, okay? And then the next thing, let's go down here to hearing and balance. Cranial nerve what?
That's
7, 8.
7, 8.
Just 8.
8. Okay.
And then on either side of that, we have anterior taste, and that's the anterior 2/3 of the tongue. Is going to be the one before it, which is 7. And posterior taste
Here's
is the
9.
one after it. Okay, and those are all your special senses. Now this also does salivary, because that means it's parasympathetic motor, because you need to be able to have saliva in order to
To melt.
taste.
To melt.
And this one also does salivary. So these are mixed nerves. It turns out we have 2 salivary glands right here and 1 back here, posterior, anterior. Okay. All right. So then 3. What's 3? Is oculomotor. So that's eye movement. And it also has parasympathetic because the smooth muscle of the iris and the lens are part of that. So this has parasympathetic. All right. These have parasympathetic, right? Because the salivary gland is parasympathetic.
It's for digestion, right?
Yeah.
Rest and digest.
Yes.
Yeah.
Their cranial nerves are either parasympathetic
Or sympathetic.
No, not sympathetic. There is no sympathetic cranial.
Yes, that's the roccolumbar.
Okay, so
Yeah.
4 is what?
Craniosacral is.
And let's see, and 6 are all eye movement.
Oh dang! I just clicked. It's in the thoracolumbar
Yeah.
part.
Yeah.
I was like, what
Okay.
are you talking about?
Wait, but how about, I have a question now. For sympathetic, how your pupils dilate?
Yeah. It has to go all the way down
Oh,
to
okay.
T1,
Oh.
jump
And
on
then
the
from-
sympathetic
okay.
chain, come all the way
Okay.
back, and follow the aorta, goes through
Okay.
that pterygoid canal I mentioned that
Yeah.
runs through, and then jumps on to the eye. From
To the eye, to
that's
dilate
all it
them.
has. So if you sever your spinal cord above T1, you can't dilate your eyes.
Wow.
Jeff,
You
you're a
know,
genius. Thank you so
All
much.
right. So that leaves one in the middle, which is cranial nerve 5, parts 1, 2, and 3, which are primarily sensory. Okay, all the sense all over the place. But sub 3 here also has muscles of mastication. Okay, so the muscles that move the mandible, your chewing muscles.
okay.
So temporalis, masseter, medial and lateral pterygoids, and interdigastric, and some other ones on the inside that you guys don't know about. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and then 10, vagus.
So there's 3 5s over
10,
there.
vagus is, if you'll excuse my French. Okay. It does everything. It does skeletal muscle, it does smooth muscle, it does special senses because it also has taste buds. It's everything. And it's up, it's down, it's all over the place. So there isn't a single thing that it doesn't do. All right? And it's the one that works below that. And so that leaves us with 11, which is muscle only, and 12,
Skeletal muscle?
yes, skeletal
Okay.
muscle.
Does your thing twist?
Yeah.
It's like a steering wheel.
Yeah. Oh. Let's go.
So this is tongue,
Does
right?
mine twist?
Yeah.
Yes.
Oh, good.
And this.
And then that is sternocleidomastoid. And these ones, this is skeletal as well.
Those are in the sacral part, right? These 3 in the sacral?
No,
Sacral?
no,
it's
sacral
still
or
cranial.
the pelvic
It's
spine
still
nerves.
cranial?
Yeah, this
Yeah,
is
because they're all cranial nerves.
10, 11.
And this is
okay.
skeletal as well too. Okay, and this is both skeletal and, so this also includes smooth. All right, so that's what the smooth is the parasympathetic. These are skeletal. So this is going to have parasympathetic in it too, right? Because it's got everything.
She needs you actually so we